Oh, welcome to your favorite health show right here on Ebru TV, My Doctor, every Monday to Wednesday, 10 a.m. to 11 a.m. My name is Purity Musel, and you're watching My Doctor show. Now, oral disease is one or is still a major problem in the world population, affecting about 60 to 90% of people globally. Now, the World Health Organization has estimated that 3 in every 4 children here in the country, they have a gum disease, and also 98% of Kenya's population suffer from one of these oral-related conditions. And we dedicate our today's show on oral care. We will be talking about or looking at all aspects, all there is about oral care. And in studio, we will be having Dr. Alan Ochanji, who is a dentist, to just help us understand how to care for our oral health. Remember to be part of this show. You're welcome. Talk to us. The SMS line is 20268, which is free of charge. The call line will be displayed right at the bottom of your screen. But just before, I could ask you to sit back, relax, and learn from this exciting show ahead. Earlier today, we had visited Dr. Alan Ochanji at his clinic at Emerald Dental Surgery Clinic, where he was taking us through some of the ways to care, practical ways. We had a few practical ways of caring for your mouth. So I just hope that you're going to learn from that. And when we come back for the second session of My Doctor Show is when we will be welcoming you to call us live through the number that will be displayed. Talk to us on Twitter at Ebru TV Kenya and the hashtag My Doctor. Once again, the SMS line is free of charge, 20268. Let's have a look at that first session of My Doctor Show, which is a demonstration at Dr. Alan's clinic, which is Emerald Clinic here in Nairobi. Take a look. So here at Emerald Dental Surgery Clinic, we will be speaking with Dr. Alan Ochanji, who is a dentist and who also will be taking us through some of the ways to prevent yourself from getting some of these teeth or mouth-related conditions such as gum disease, gum cavities, and so forth. We will be looking or having a demonstration on how to properly brush your teeth for both adult and also kids. Will also be having a look or demonstrating for you mouth washing practices, how many times are you supposed to have it, and also scaling, which is a process that every person should go and check or see their dentist to just ensure they don't have some of these conditions. That is what we are here to do, so just stay tuned and follow me. Hello. Hi. Hi, I'm Purity from Ebru TV. We are here for the My Doctor Show program. I don't know whether you could guide us in getting Dr. Alan Ochanji. Okay. Yeah. All right. Hello, Doc.
Hello, how are you?
I'm okay.
Welcome to Emerald.
Thank you so much for allowing us come to your clinic today.
You're welcome.
Yeah, and as we had earlier on, I told you that today we want to talk about oral hygiene. That's why we are here today, to just have a look at some ways of preventing ourselves from getting these oral related conditions. And maybe before we get to what we came here to do today, you could just take us through some of or what really, when you talk about oral hygiene, what does it mean?
Thank you, Purity. Oral hygiene is very important. The mouth has several structures, and anything affecting any of the structure can present in terms of a pathology.
Right.
And when you talk about the oral cavity, we have the teeth there, we have the gum, we have the tongue, we have soft tissues, and then the mouth communicates with the rest of the body. So the rest of the GIT is connected to the mouth. We also have the sinuses and the nasal cavity and the rest. So we have any problem affecting the mouth, it will eventually affect other parts.
Right.
And so it's very important to have good oral hygiene. And when I talk about good oral hygiene, I mean a case where you don't have cavities, you don't have bad breath, you don't have discoloration, you don't have cases where dehydration affects your tongue, and all those kind of things. And so when you come in a facility like this, most importantly, we emphasize on the techniques you need to use to do brushing. Because if you brush well, chances are you'll not have so much of a problem. Then once you've done correct brushing, you're supposed to come for regular checkups. We advise that at least once in a year, the best will be twice in a year, you come, we check if there's a problem, we advise you in good time. The other thing that you need to do, apart from good brushing, you need to change your toothbrush every so often. Then when you talk about bad breath, there are other causes that are not really related to the mouth. If you have problems in your the rest of the gastrointestinal system, it could present as bad breath. If you are dehydrated, for example, it could also present as bad breath.
Right.
In cases where there are also psychological environment where you think you have bad breath, but actually you don't. So all those, you come in a setup like this, we assess, we advise you, and then give you the way forward. So probably the basic thing and most important thing that I can demonstrate here, it's how to brush. And I'll introduce you to my patient. I'll show her how to brush.
Right.
A simple way, because if you brush right, 90% chances that you'll have a good oral hygiene.
Right.
And then that, most important, it will prevent you from getting, because the treatment part of it comes once you already have the problem.
Right.
So,
and just before we get to the brushing, Doc, maybe you could just list to our viewers some of the techniques that we are looking forward to have them demonstrated right here at the clinic.
one is the correct brushing technique. On and off, we normally advise you to use mouthwash, not continuously, because if you continuously use the mouthwash, it kills the normal flora in the mouth. So you use it intermittently over a given period of time, and then you stop. We also have a dental floss that goes in between the teeth. I don't have an interdental toothbrush, which is also very important. It goes in between the spaces of the tooth, so it removes the debris that will stay there. And with the normal brushing, the areas you can't reach. So the floss plus the interdental toothbrush will go into those areas. So we'll show you again, once you have a problem, what you need to do. I'll demonstrate how we do scaling under the chair.
Right.
We also do polishing. And then other than scaling and polishing, if you have a cavity, you need it filled.
Okay.
If you have malalignment that is making it hard for you to get a proper cleaning, you also have to get them aligned. So any problem that will contribute to an area of stasis where food will go in will eventually contribute to bad breath, will eventually contribute to poor oral hygiene.
Right. Maybe we can start with correct, like you call it, correct brushing, right?
Sure. So what we'll do, kindly come with me. This is a toothbrush,
Right.
and a soft one for that matter. There are a number of them in the market. So this is just one of the many. This is from Colgate,
Right.
but you have a number of them. And if you can see, the bristles is completely different from the rest. It's soft. Whatever we're removing in the mouth is not hard. So it does not benefit anyone to brush with a lot of force. The technique is how you use it,
Right.
frequency, and with what material. And then with me are two common products in the market. This is Sensodyne, this is Colgate.
Right.
These are just toothpaste that anyone can use depending on your preference.
Right.
And then, so normally what happens is you use this to reach every surface of the tooth.
Right.
So you just come with me, hold this. You'll choose one of them, whichever you want, and then you load your toothbrush. So normally what happens is,
What's the size? Can you just put any, what amount of toothpaste are you supposed to use, or just any? You know, some other people use a lot of toothpaste, others use just little. Is that recommended?
we're not specific on the amount you're supposed to use, but what will guide you on the size of the bristles.
Okay.
So something going 3/4 to full amount is good enough to cover the surface.
Right.
Then you can see she's done that. So just come to the sink here. It's okay. So what I want you to do is to make sure that you clean every tooth surface. So the tooth has like 3 surfaces, if you can say. There's the outside part, there's the on top, and then there's the inside.
Right.
So when you're brushing, you make sure you clean on the outside, you clean on the top, and then you clean on the inside. When you're cleaning, you don't choose a lot of force. For efficiency, you can decide to group the teeth into maybe a group of 4 or 3. So when you're starting from here, you can put a group of 4, brush them, dedicate a number of strokes. Let's say when you're starting here, maybe you dedicate 10 strokes. So you do 10 here, you do 10 on top, you do 10 on the inside. Once you've done that, you move to the front teeth, the ones that we call anterior teeth. Then you do the same to the other side. You do whatever you've done on the lower side, on the upper side.
Right.
Maybe we can just try on one segment, not the whole mouth, just so that we get to know the exact thing we need to do.
And should she maybe mix it with water or take some water first?
Just for greasing, maybe when you're starting, you can just put it in water or put a little bit of water on top of it to make sure that it's soft and also the greasing is okay.
Right.
Then you can, there's no preference where you can start. You can do it any segment. So in this case, you've chosen to start on the fourth quadrant, the one you say. So in my model, I would expect you to brush on the outside, which you're doing very well. Dedicate a number of strokes on the outside. In this case, we're choosing 10. Okay. Then you go on top. Before you move on to the next, make sure you focus on that side.
Okay.
So we are on the second surface, that's top surface. Dedicate a given number. Good enough. Then now let's move to the inside on the same segment, but the inside. So you see, she has done the outside.
Right.
She's done the on top. She's now doing the inside.
Right.
Okay. And once we're done with that, now let's move to the front segment. So you see, the angulation of the brush will now change. So whatever you are using posteriorly is not the way you're going to use it here. So in front, we'll just expect you to brush on the outside, the way you're doing. And then on the inside. The inside sometimes, so that you reach the teeth, you can put it like that, but on the bristle. So you do back and forth like I'm doing, to make sure it goes to every tooth surface.
Right.
You dedicate a given number of strokes as well. Okay. The trick is in the technique, is not the force or how much you. So you do that to all the teeth surface. You could extend to the other quadrant and then do outside and top and the inside.
Okay.
When you're done with that, you just rinse with water. Like in this case, there's water there. You rinse, and then you make sure after rinsing, you clean your toothbrush as well.
Yeah.
And then there's a technique of also.
So she'll pour.
You just rinse here.
Rinse here. Okay.
Here. And then clean again, just to make sure that all the traces of toothpaste is eliminated.
Is it okay, Doc? First, how many minutes should you dedicate for brushing? Because some people go it for like 2 minutes, you're done, and the way you explain, you have to, have a section of brushing your teeth. It's like it can take even up to 10 minutes, but many people really take even 2 minutes, 3 minutes.
Actually, 2 minutes is a lot. Most people take under 1 minute. Actually, then they're late for work. Anything between 3 and 5 minutes will give you an adequate time. And that's why we advise that you brush in the morning after breakfast, but most importantly, before you go to bed. Because that's the time you've just eaten, you have ample time, and also the rate of saliva flow reduces when you go to bed. So just before you go to bed, make sure you brush very well every tooth surface.
You're recommending twice in a day, right? Twice
in a day is good enough. If you can do 3, the third one you do in the office, well and good. As we'd advise that, make sure you do it well and good in the morning, after breakfast preferably. People find it hard sometimes to brush before or after breakfast, whichever is preferable for you, but we advise that you do it after breakfast.
Right.
Then just before you go to bed.
And just before we get to the next step, why is it important to have, a routine, a correct brushing routine, as you call it?
Because brushing is the most important aspect. If you don't brush adequately, eventually you have food materials lodging in between the tooth and the gum. Because between the tooth and the gum, there's usually a crevice, a space. So that's where food goes in. If you don't brush adequately, food will stay there. And the first symptom will be bleeding of the gum, then eventually you'll have bad breath.
All right.
So to eliminate that, you must get it right with brushing.
All right.
80% of the problems in the mouth, you will sort it out with brushing. Then now the extra 20%, we can look for where the problem is and sort it out.
Right.
Then just before we conclude, we also have other aspects. As I told you, this is a floss. A floss is just a string. So what happens is, you just cut a piece.
And maybe that would be all for correct brushing. I think other questions will come from our viewers. Now we are moving into flossing, right?
Yes.
Maybe you could tell us what it is first and how to go about it.
Flossing is just, in a layman's term, is just a string, but in this case is enriched with some fluoride to protect your teeth. So the idea is to make sure that whichever place you can't reach with a normal toothbrush, you can reach with the floss. Okay. So you just take a piece and roll it in your fingers, then you pass it back and forth in between your teeth.
Yes.
So probably you could also have try X and just try if you can read. Mine I'll do in the model. Sorry, my model does not.
How many times are you supposed to do on a daily basis, or?
This is something that you need to do on a daily basis. Probably the most important time is just before you go to bed. Again, because you have ample time, you just take it in between your teeth. And you roll it long enough. Just fold it again so that you have adequate length, and then just pass it in between the teeth. Just open wide, open your mouth. Yeah. You do it on one side. Yeah, like I'm trying to do mine.
And should you exert so much pressure, because I think
you don't need to put a lot of pressure, because again, if you use a lot of pressure, you're going to hurt your gingiva, and then it will cause bleeding. So instead of getting the beneficial aspect, you'll be gaining more pathogen. The other thing is, apart from the floss, I'd say there's an interdental toothbrush that actually goes in between your teeth. So when you do that, you clean them off.
And Doc, what could be or what should be used for flossing? Because most of the people do not have what we are having here today. Others use just the normal, do we call them?
Others use toothpick.
Toothpick.
Go in between the teeth. The most recommended is either dental floss, because they're designed for that, or an interdental toothbrush. Because they are small brushes designed for the spaces in between the teeth, and they clean very well. The advantage with those is that you don't get injuries. Toothpick you can use, yes, but they'll end up in injury. Then the floss itself is enriched, sometimes with fluoride, so it has beneficial aspects. That's why we advise on flossing. We advise on using interdental toothbrushes.
Right.
Yeah. And then the last thing is you also need a mouthwash from time to time. This is Remedin, but there are so many others. This is chlorhexidine, but there's so much in the market which you can use.
Again, why is it important to have some mouthwash maybe once in a while? Once in a
while, it's important because this mouthwash has antibacterial activities. And then it also has what we call anti-plaque activity. In other words, it prevents food materials from attaching onto the tooth surface. So when you use it, you get the benefit of not having tooth materials attaching onto your tooth surface. And also, it has antibacterial activities. So bacteria that will cause gingival inflammation and cause bad breath, you get them acted upon by this particular mouthwash. So this one you just get a bit, not a lot. You just put it in. That will be enough. Get a tumbler, put it there, and then put it in the mouth. Then you make sure it stays in the mouth for a minute or so before you spit, and then you don't rinse immediately. You wait for maybe up to 10 minutes for it to get into all the areas, then you can rinse. Okay.
You can use some?
This one, you can give me some to use. So that you get this one you had already used, so we clear it off, put it there for you. Then you can use that to rinse.
So what's the procedure? She'll take it, then she'll have to gargle it.
You'll gargle it.
Yeah.
Like in my case, put it like this. Out. And gargle. Yeah. For a minute or so. Okay. In this case, maybe not a minute. Then you spit. Not a lot.
Yeah.
After that, you don't rinse immediately. You give it up to about 10 minutes for it to sink completely into the crevices. Then after that, you just rinse with the normal water. So that's a routine that you need to do probably over an extended period, maybe 2 weeks, then you stop. Because as I said, again, if you overuse it continuously, it has problems.
Okay.
That comes with it.
Well said.
So probably the only other thing I can show you is
flossing and mouth washing.
We are assuming that when you do all that, there will be no problem. But should there be a problem? Now that's where we come in terms of doing actual procedure. So probably what I can show you here is should you be having the problem, you're having bleeding gums, you're having cavities, you're having bad breath, what do you need to do? You need to do all this I've explained, but on top of that, you need a professional help. Like in this case, most importantly, we do what is called scaling and polishing, where we remove all the debris and all the tartar, they're called calculus, that get attached onto the tooth surface. So probably that's what I'll demonstrate shortly. Just come back.
So I can see now we're getting to scaling, which is one of the ways of treating gum diseases, right? If I'm right, Doc, maybe you can just explain to us what about it and maybe demonstrate to us how to go about it.
You're right. Scaling is very important. We do it in cases where you already have a problem. And the problem is, between the tooth and the gum, there's usually a space. Over a period of time, food particles accumulate in those spaces. And then with that, you get bleeding gums, you get swelling, you get bad breath and all that. So suppose you have that problem. You come to our clinic, we assess, and then we see. So it's simple. What happens is, we check into the mouth. My patient is okay, she's comfortable, you've explained everything to her, and she's easy. So all we do is just to check where the problem could be, and then if need be, do the treatment. So in this case, I'm examining her. I'm looking at the number of teeth she's having. You can see generally she has good oral health. So in a case where my patient comes with complaints, I first assess and see the whole mouth where the problem could be. So I'll assess if there is any cavity. I'll assess if there is bleeding gums by just running my probe gently. I'll see if there is any tooth that is overlapping the other. I'll check, just put your teeth together. I'll check the arrangement of the teeth. Open again. I'll check the tongue surface, if it's clean, if it's okay. All right. Then I'll make more emphasis on the space between the tooth and the gum, because that's where food particles goes in, and then the spaces in between. So this is the area of interest, all right, like here. Just put your teeth together. These are the areas of interest.
There's some bleeding there?
Yes. What happens is if the gum is inflamed, sometimes when you touch this, easy bleeding. So all that we do in scaling and polishing is just getting an instrument that can easily go into those spaces and do some cleaning, and then after that. So this is what we're going to do shortly. So my instrument releases water. So all I do is to open. So all I do is to target those spaces, like there, run my instrument which is releasing water into those spaces.
Doc, you see that's what? That's scaling?
This is scaling.
Okay.
This my instrument is called scaler. So all it does is it vibrates. As it vibrates, it releases water that goes in between those surfaces.
Again,
So
it's
do it there.
important.
So you do that to all the surfaces. Remove all the debris, remove all the calculus, we call them so. That is on the tooth surface, and that is presenting in terms of bleeding and bad breath. Now, this is something that you do for the whole mouth, every tooth surface. You make sure your patient is comfortable and there is no pain when you do it on all the tooth surfaces. Once you're done on the outside, you also come on the inside and do the same.
Okay.
So what I'm going to do next is just polishing on that surface we had worked on. And then normally what we advise is once we've done the scaling, sometimes we give the patient time off just to go for the gum to have some healing, then you come back for polishing. That makes sure that we're doing the polishing when there's no bleeding and when the gum is okay.
Right.
So in this case I just rinse again. Just rinse to make sure everything is clean. Now the tooth surface. As you can see fresh areas where we removed all those debris and they're now clean. So all we do is to put up a paste.
What's that?
This is called trophy paste. It has a topical fluoride in it. It has some abrasive pumice for cleaning off all debris. And most importantly, it has fluoride that has anti-caries activities. So what you do is just to rub it gently on the tooth surface. And once I step on it, it vibrates. So I just clean off like that. Like that. Like so. Like that. Like that. I do the same on the inside. Where I just smear it on the tooth surface. Make sure you put enough amount and then just clean it. So all I can say is this is a professional way of doing toothbrushing. So whatever I was explaining is for you to do at home. Whatever I'm explaining is what we do under the chair.
And again, for polishing is also once in a year, right?
Normally it's done together with the scaling. Actually, if you come regularly, it's the polishing that we will be doing every time you come. We only do scaling where you have calculus on your tooth surface.
Okay.
So once that is done, you just rinse gently with the water.
So this one is for taking the dirt and the water to...
So this is just a suction tip.
Okay.
It's used to remove all the water, all the saliva, all the debris into a sealed system. So that is that for the front tip. As you can see, the teeth are clean. Fresh areas where the debris and they've removed, including the inside as well. This is something that we need to do for the whole mouth. We've just done the front tip, but we also do it for the others. So the advantage of that is that it removes all the debris on the tooth surface.
Right.
And then it leaves the patient with a fresh surface that is easy to clean.
Right.
Normally, after the cleaning, sometimes some people get sensitivity. So all we do is we advise them on what to do after that and remedies to use in case they get sensitivity. Overall, it's a very simple process. It's easy and it's very important that people should do at least once in a year. It helps you take care of good teeth.
Right.
And also make sure that you don't end up in a problem that people encounter in the mouth.
All right.
Apart from that, there are a number of things that you need to do. If there's cavity, you need to have it filled. If there's a tooth that is buried in the bone or is partially erupted, you need to get it out. If you have any pathology anywhere, you need to take it out. The other thing that I didn't talk about is when you're brushing, also spare time and brush the surface of your tongue, because it also harbors a lot of food debris and it needs to be cleaned.
Okay.
So the tongue surface, every tooth surface, everywhere in the mouth, clean it. And it helps us because, as I said, apart from being the organ you use for eating, it also connects you to the rest of the body. So you have the rest of the GIT, you have nasal cavity, you have the sinuses. So you need to have it as clean as possible.
And so that would be all for this segment of My Doctor Show. But to receive your calls, to also respond to some of your questions in studio, we will be having Dr. Alan Ochanji use the SMS line, which is free of charge, 20268. You can also call us live through the number that will be displayed right at the bottom of your screen. On Twitter, we are at Ebru TV Kenya. And yes, we will be talking more on oral hygiene. So see you in studio. Welcome back. You're watching My Doctor Show. We are live in studio and we just had a very comprehensive session with Dr. Alan Ochanchi at his clinic at Emerald Dental Surgery Clinic here in Nairobi, just taking us through some of the ways of protecting or even caring for your teeth. Now, this is the session that we'll be picking your calls live here in studio. The call line is displayed right at the bottom of your screen. You can also send an SMS through the number 20268, which is free of charge, and we will be glad to respond to them. My Doctor Show continues, but first, let's have a look at the home remedies. Time now to have a look at your feedback. We will be checking your questions, and also feel free to call us through the number that is displayed right on your screen. And now help me welcome live in studio Dr. Alan Ochanchi. First, let me appreciate and thank you for allowing us come to your clinic and have that important demonstrative session of My Doctor Show. And thank you again for coming here live in our studios. We do appreciate. I don't know where maybe we can pick a few questions, but before then you could just help us understand what do we have in the mouth in terms of teeth, the full set of teeth. When we're talking about the young people and the adults, how many are we talking about, Doc?
Thank you for having me to My Doctor Show again. That clip has sort of summarized what we need to talk about.
Right.
But in the mouth, again, as a way of highlighting, we have teeth, we have gum, we have salivary glands, we have saliva, we have taste buds, we have the tongue. All those structures function to help us chew and taste food. But again, a problem could occur in any structures mentioned. In an adult, we'd expect to have 32 set of teeth. In a young person, a kid, we have 20 number. So in between the 20 and the 32, there's a transition that occurs, which is called mixed dentition. So during that period, there need to be care to make sure that a child attains the full set of adult dentition as the transition occurs.
Right.
Yeah.
And Doc, you could tell us, because the mouth is the gatekeeper for every one of us, and keeping it clean or oral hygiene could be very important and necessary. But Doc, what could go wrong, you know?
Oral hygiene is very important,
yeah.
And anything can go wrong. Any structure can have a problem. So if you have a tooth, so it can get a cavity. You can get gum infection, you can get blockage of salivary glands, you can get trauma, especially in kids when they are engaging in kids' activity, they could fall and have tooth fracture. You could have bad breath as a result of maybe inadequate brushing techniques, or you have anything that harbors food material into the mouth, or you have a pathology in the rest of the body that is presenting in the mouth. If you have a systemic condition, let's say diabetes, you first of all get it presenting in the mouth,
right,
apart from other areas, because it's a systemic ailment. If the medication that you're taking, there's also a way that they can affect the mouth. Also, if you're dehydrated, you could also have some of these effects right in the mouth. So there are a number of things that can go wrong, and as you've said, mouth is a gatekeeper to the rest of the body, so there's need to make sure it's healthy.
Yeah, and staying with that, someone is asking about the bad breath. Okay, let's have a look at the common ones. We've talked about gum bleeding and also the issue of bad breath. They're asking whether it's a condition or what causes it, and can it be prevented?
Bad breath can be prevented. Almost 90% of causes of bad breath are in the mouth. So most commonly is as a result of inadequate oral hygiene measure. Either you're not brushing very well, you're not doing it adequately,
right,
or you're not just cleaning completely. And then on top of that, maybe you have a cavity somewhere that will harbor food materials. Again, the cavity will prevent you from cleaning.
Right.
You could have malalignment. Again, that hinders the process of cleaning, and also makes it easy for food to stay in the mouth. So whatever causes bad breath, most importantly, they're in the mouth. You could also have food materials staying on the tongue surface.
Right.
Then a small chance you could get bad breath as a result of whatever is happening in the rest of the GIT system. If you have dehydration, again, it depends with the diet. Maybe you're taking garlic stuff or you're taking onions, they will also result into bad breath. If you are dehydrated, for example, you also get bad breath. Also, sometimes when you wake up in the morning, it's not automatically because the rate of saliva flow has reduced overnight. So when you're waking up, there's chances that you can get bad breath. Plus a number of things that could cause it. Now, if you brush very well, that means almost 90% chances of bad breath are eliminated. So just make sure you have the right brushing technique. Make sure all the cavities in the mouth are filled. Make sure you have correct alignment of the teeth surface. And then once that is done, any other thing that is presenting will be treated as a separate pathology.
Okay, let's pick another question. If someone is asking about how much, but we'll be talking about the cost treatment for your services.
Okay,
but someone is asking, I'm Roy Lex from Kayole, watching Ebru TV. I love the program. Thank you. My question is, how much does it cost? So many questions on how much it costs. Okay. Can you respond to that, or will you get into
that? It really depends. There's never a standard cost. So unless you assess and see and give the situation, that's when you can put a price tag.
Right.
But the most important is to get the information and know what can go wrong and what you need done.
Okay. Morning, my question is, how do I get rid of the black stains on my last tooth, and why is my tooth breaking? Joyce.
What happens is demineralization occur, and most common cause is dental caries. Once that happens, the tooth surface becomes so brittle that when you're chewing or doing anything with the teeth, they can start breaking. So you need that tooth filled to prevent it from chipping away. The stains on the tooth surface, one can be removed when they're doing the filling, but again, there's what we call scaling and polishing, which we demonstrated in the clip, that helps us in eliminating all the stains on the teeth surface.
Right.
So you just need filling, scaling and polishing to eliminate the stains. Okay.
And hello, Doc. I've seen your instruction on a patient to brush their teeth, and I did not see her brushing the tongue. My question is it necessary to brush your teeth without brushing your tongue?
Yes, I highlighted it in the clip. Brushing the tongue surface is very important. I said not brushing is one of the causes of bad breath, because it harbors food materials on the dorsum of the tongue. So you also need to clean it. Some toothbrushes come with an allowance on the backside of cleaning the tongue surface. So just make sure that as you clean the rest of the teeth, tongue itself is a structure on its own that needs dedication in terms of cleaning to make sure it's healthy and is not causing any bad breath.
Okay.
Yeah.
And we are dedicating today's show on oral care routines, or some of the tips in which you can care for your oral or for your mouth. And we have Dr. Alan Ochanji, who is just giving us some tips on how to go about that, how to treat some of these oral diseases, such as the gum bleeding, dental cavities, and also bad breath. Talk to us. The SMS line is free of charge, 20268. You can also call us live through the number that is displayed at the bottom of your screen, or talk to us on our Twitter handle at Ebru TV Kenya, and the hashtag is my doctor. And Doc, before we get to because you've talked about the hygiene as one of the causes for the oral diseases that we are seeing, and someone is asking about the kind of diet, just before we get to that, Doc, do we have causes for these infections that we are seeing that you just talked about?
It's very simple. If we understand it this way, that food materials are not supposed to remain in the mouth. So what follows is that you have to engage in measures that will eliminate all food materials from your mouth.
Okay.
And that's why brushing techniques becomes very important. 80% will be sorted out by correct brushing technique. Suppose you have food materials remaining in the mouth, that will be the source of infection. So one common type of infection is called dental caries. So the infection will present in terms of cavities. Another infection is called gum disease or periodontal disease. It will present in the form of bleeding gum, swelling. When you're brushing in the morning, you'll find bleeding in the morning. Also, it presents in a number of ways like bad breath. So most important cause of dental infection is food staying in the mouth. Other causes could be pathology. So you have a salivary gland, you have an ulcer in the mouth, you have gastrointestinal problem that present with bad breath coming out in the mouth. All those could cause, but the most important thing is to make sure there's no food remaining in the mouth.
Okay.
So the best is to make sure you brush twice a day, morning and just before you go to bed. Okay.
So for you, it's just ensure that no food remains in the mouth. It doesn't matter what kind of food, because someone is asking, how does sugary food cause or lead to teeth illness?
Sugary food will eventually affect the teeth surface. The tooth is made up of enamel, dentin, and the pulp, and is a mineralized tissue. When you have a lot of sugar in the mouth, they're broken down into an acid because you have bacteria in the mouth. Now, an acid is against the integrity of the tooth because it will end up with erosion and eventually you have cavities. So yes, sugary diets will affect in a bad way your teeth. So you have to limit. If you have to take them, make sure you clean after taking them. Okay. And then the same with the diet. Diet mostly affect the children, even adults, because you know in children they're still growing up, the teeth structure is still getting to full integrity. You have to make sure that they engage in the right diet, and then you monitor for them because they learn the good habits or the bad habits from you as a guardian. So you guide them through the process to make sure they get the right technique and to make sure they engage in the right diet.
Okay, and we have Lillian. Hello, Ebru TV. My name is Lillian from Machakos, and I have a hole in my tooth. And what should I do about it? And also, what is the name of your clinic, and where is your location in Nairobi?
The first part of the question is the cavity. What you do with the cavity is you get dental filling. There are so many materials you can use for filling, but the ultimate message is get the tooth filled. Now, there are cases where you have pain. You just don't do filling. Before you do the filling, there's what you call root canal treatment to eliminate the pain, and then after that you do the filling. So you have a hole, get it filled. You have pain in the hole, get root canal treatment done, and then eventually you have filling. We are located in Nairobi, in Hurlingham, Emerald Dental Clinic. So any day we are open. Okay.
Right. And I'm Jacinta. I just want to ask the doctor, why does the tooth extraction has to be in full glare by the patient? They can't sedate a patient because it's always painful. First tell us, was the patient that we were having there, was there any pain that she was going through, and answer what Jacinta is asking?
Actually, from the clip, suppose my patient was in pain, you would have seen a reaction. Okay. My patient was very comfortable. So we offer tender loving care where, you know, healing is in the mind as well. So before even we get to the procedure, we go through a session of counseling and just getting to inform you what to expect. And pain is the least of your worries because with the advances of treatment and in dentistry, there are a lot that we can do to contain pain. When we're doing extraction, we do it under local anesthesia because it's a simple procedure. But there are complex cases where maybe you do more than one extraction in a case where we call disimpaction, where we have the wisdom teeth that are buried in the bone and we have to remove more than two. Those are the cases we can take you to theater. But removing one or two teeth, they're normally simple procedures that we just do under local anesthesia. And pain management is very important, not just for extraction, but even for any other treatment. So pain should not be your worry, because there are so much advances in terms of doing the pain. And even so, we counsel you and give you the expectation at the end of the day. Okay.
And still staying with what Jacinta is asking, Doc, there's some people, no matter how painless the process is, they just do not want to witness what is going on. And maybe if you ever had a toothache or a problem with their tooth, you know what I mean. It's really painful. Sure. Is there a way you can protect them from seeing what is happening because they just do not want to see?
Actually, we have more than just the local anesthesia. We have other things like sedation. We have general anesthesia, where the patient maybe is anxious, does not want to go through the procedure and all that.
Right.
So there are means and ways of treating and dealing with anxiety on his own, on a patient in this case. But more importantly, you have to know that sedation and even the general anesthesia, they also have their side effects and drawbacks. So we have to weigh pros and cons versus the procedure we're doing, because we'll explain to you and ultimately you're the patient, you will decide, but we'll also have to give you an opportunity to know the drawbacks. For example, if you go under the general anesthesia, there are also things that could go wrong. And we have to make sure the procedure we are doing, the benefit will outweigh the side effects that come with it. So we weigh both of them.
And are you having problems with your teeth from the gum bleeding, any pains, and also dental cavities or even bad breath? Then this is the show you should be watching right now, because Dr. Alan Ochanchi is just helping us to know some of the tips on how to care for your teeth or oral health tips. The SMS line is free of charge, 20268. You can also call us live through the number that is displayed right at the bottom of your screen. And Doc, now let's have a talk on children and oral health. The way we were seeing how to correct brush your teeth, mouth washing, flossing, and all that, does it also apply for kids?
For kids, timing is very important because most people, most parents actually, and most guardians, they start growing interest in the teeth of the kids when they're really old. Maybe they are going to school and they start taking interest when it's already late.
Right.
The right time to start is actually when the teeth have not come into the mouth. You have to clean with a cotton gauze, just put it in normal water and then clean that part even before the teeth come into the mouth.
Right.
Because you realize the milk that the mother has a lot of sugar. So it affects the development of the teeth, and when they come into the mouth already, because of that sugar, there's erosion. I'm sure you're well conversant with kids that have black teeth all over.
Right, yeah.
It's because the mother's milk has a lot of sugar and they don't take good care of it. It causes erosions and eventually decay. So all important is you need just to clean the tooth surface. When the teeth are up in the mouth, you just clean with a normal gauze. Make sure you remove all the milk in the teeth surface. And then as they advance in age, you introduce a brushing technique. First of all, you have to show them how to brush. Then as they continue, they get the tips from you. And then as they advance in age, they're able to brush on their own.
Okay.
Most importantly, you have to monitor the process. And you also have to, as an adult, make sure you're practicing good oral hygiene so that they pick those good habits from you.
Okay.
Diet is very important for kids. Make sure you give them good food, balanced diet, and then avoid snacking, most importantly, towards bedtime. When they have to snack, you have to make sure they brush. All those will make sure that they grow having good oral hygiene. People think that after all, the milk teeth will fall off, so we don't need to put emphasis. That is contrary to the truth. The milk teeth will help the kid to chew and do everything, but most importantly, they'll preserve that space for the permanent to come into place. So if you lose the milk teeth slightly early, then the permanent tooth will have problems coming into place.
Right.
Either they'll miss the place or they'll not come into place completely, or if they erupt, they'll erupt in the wrong place.
Really?
Sure.
Okay, and before we pick this one question, we have someone who is calling us. Maybe we can hear what they have to say. Nelly, yeah, it's Nelly from Nairobi. Hello, Nelly.
Hello, my name is Nelly. I'm asking, I'm inquiring on teeth implants, whether the doc does teeth implants.
Okay.
And could you kindly take me through the process? Are there complications thereafter, or how is the process done and the cost?
Right.
Please.
Thank you so much, Nelly. That's a very important question, you know.
Thank you. She's brought a very important aspect.
Yeah.
What happens is when you lose a tooth, there are options for doing replacement.
Right.
We have from intermediate or rather temporary to a more permanent means. And dental implant is just one of the many options for doing replacement.
Right.
What happened with the dental implant is there's a material that comes in form of a screw. It's made of titanium. So it goes right into the bone, okay, to replace the missing root. Okay. Then over onto that we anchor what we call the crown. So eventually the patient will see the white part as the tooth, but what holds the white part is the titanium that is right inside the bone. Now she's asked whether there are problems that occur with it. Before we do implants for you, we'll have to do full general assessment. So are you healthy? Is there any systemic problem? Are you diabetic? Are you hypertensive? Are there medication you are taking? Is there any problem with the bone and all that? Once we have done our due diligence and you're a good candidate, dental implants are very good. They're very effective. Sometimes they outlive your natural teeth. So they're very good, they're very important, they're a very nice way of replacing teeth. And whatever side effect that will come, it lies in assessing the case as it is and eliminating all the preliminaries before you get to actually do the case. Where sometimes we have very thin bone that cannot support the implant, we do a bone graft to make sure there's enough thickness of the bone to cover it and to protect it. So yes, we do it very frequently. And all my clients I've done for dental implants are happy. Yeah.
And she was asking about whether there are any side effects after, after the implant. Are there implications?
After you've done the implant, whatever can affect the implant is the same thing that can affect the rest of the teeth. So most importantly, you need to be put on a regular recall visits, that is reviews, just to make sure nothing goes wrong. We'll have to advise you on how you need to clean implants, because cleaning the implants will be slightly different from your natural teeth. And then if you keep a good track of regular recall visits, there's nothing that will go wrong.
And as we wind up, kindly answer this specific question. Hello, Ebru. I have had my 10 teeth extracted and I have 22 now. I want to replace all of my lost teeth, and how much would that cost me? The last time I had a tooth extraction was 6 years ago. Please help. I'm Virginia from Nairobi.
Okay, I'll start with the last part. How much will cost you? It's very hard to tell, because one, you have lost a total of 10 teeth. We don't know if all of them are in the same arch or they are in different arches. We don't know if they're in the same place or different places. Having said that, replacement, there are so many options. From what you call a denture, which is usually a temporary means, to what we call a bridge, to what you call most advanced dental implants, which I've just addressed. So what we do, we assess your case and then design a unique treatment plan for you, which will suit your case. Then now your treatment plan will dictate how much you will be charged for that particular procedure.
And if I was Virginia, I know she's concerned, like roughly how much are we talking about? Maybe are you in a position to, in every category that you've said, and every option that there are for her, maybe roughly how much are we talking about?
It's a whole range. Like if you're talking about a denture is something very cheap. So it can start depending on where it's done, a range of maybe 5,000 going onwards. It can reach 20,000 depending on how many teeth you're replacing. We have bridge. Again, it depends with which type of material. We have old porcelain, we have metal fused porcelain. Again, we have implant. So it's really hard to put a price tag at this point unless we make a treatment plan and really see. Because dental implants are more expensive because even the material itself. And averagely in the market, dental implants go for well over about 100,000. Yeah.
And kindly just tell our viewers how they can get you.
We're located in Hurlingham, Rose Avenue. It's called Emerald Dental Clinic or Surgery. We open Monday to Saturday. Our contacts are there online. You can get us on Facebook. We have a page, Emerald Dental Surgery. You can get us on Instagram. You can visit our website and engage us directly. But most importantly, make sure you take good care of your teeth, because if you do that, you may not need to come to my place. You just need to get the tips and practice them. In a case where you've already ended up in problem, we are there to support and help.
And hand in hand with that, just give us a few tips on how to care for our teeth.
How to care for your teeth: 1, brush. 2, use dental floss. 3, use interdental toothbrush. 4, make sure you have regular checkups. And then 5th, make sure every 4 or 6 months, so to say, you change your toothbrushes. And then for the kids, diet is very important. Timing is very important. And the milk teeth, they are as important as the permanent teeth.
And there was a question that I wanted to pose to you. There was someone, a parent, who was concerned about the twins. I don't know whether I'll be able to get the question. Yes, my son is 4 years and 10 months old, and 3 of his teeth have holes. How do I deal with it? Because it's something that they ache at some point. That's what she's saying.
Okay. So again, coming back to my point, milk teeth are as important as permanent teeth. This is a case where they are 4 years, some months old. They have teeth that have cavities and they are painful. So in kids, we do fillings as well. But a case where you have pain like this one, we do what we call pulpotomy or pulpectomy, depending. That is just doing root canal treatment, but for children. So you address it in a way that you eliminate all the pathology, clean the pulp very well, and then you fail. So there are ways of dealing with that, and that is called pediatric dentistry or dentistry for children, and it encompasses a lot of things.
And from the whole discussion, I think the one thing that I have understood is that always ensure that there's no food remains in your teeth, right?
Very
to
important.
just ensure that you just stay away from these oral diseases that there are. Thank you so much, Dr. Alan Ochanch, for making time for My Doctor Show. We do appreciate. And there is a lot to talk about oral health, oral hygiene. We look forward to having you once again on this show.
Thank you, Purity.
Yes, and that's all the time we had for the show today. Thank you for your feedback. Thank you for calling us and also for your comments. My Doctor Show continues tomorrow, same place, same time. I'm Purity Museo. Do take care.